On our recent public health roundtable discussion, our panelists shared their public health priority for this year. I'm sharing that discussion with you on this episode. This is an inspiring conversation that you don't want to miss. You're listening to the PHEC podcast, episode 390. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. In this episode, we're sharing a conversation from a recent Public Health Roundtable Live, which typically occurs on LinkedIn, and it's during the first Wednesday of each month. Now, in this case, the first Wednesday of January was New Year's Day, so we held the roundtable discussion on the second Wednesday instead. And our panelists shared their public health priority for this year. This is an inspiring conversation filled with a few surprises from my perspective, and you just don't want to miss it. I'm sharing that conversation with you on this episode. I'll come back at the end and discuss some of the surprise insights that were shared. Let's connect the Public Health Roundtable discussion right now. Greetings, everyone. Welcome to a new year of the Public Health Roundtable Live. Happy New Year, everyone. This is really exciting. This is our first roundtable. We normally are the very first Wednesday of every month, but last Wednesday was New Year's Day, and so we pushed it back a week. My name is Dr. Huntley. I'm your host, and I'm joined by this fantastic panel of public health professionals, and we are going to kind of pass the mic so that everyone has a chance to introduce themselves, talk a little bit about what each of you do and how you serve in public health. I am the CEO of DrCHHuntley LLC, which is an epidemiology consulting firm. We specifically get excited about serving BIPOC organizations or organizations that are leading and serving BIPOC communities. So we help them to communicate their health information or health data in plain language to the individuals within the communities that they serve. I slow that down to explain because it's something so important that we often will overlook. We put a lot of work into putting together these complex reports about diseases and other things that impact our health. But sometimes when we get ready to share that with the community, a lot gets lost in the translation and we come across as kind of preaching to them or trying to shove this down their throat, and people can make really good decisions for themselves if, they are informed and understand the information. So we're very passionate about that, specifically for those BIPOC communities. I also am the host of the Public Health Epidemiology Conversations podcast, and we are real excited about that because we've been delivering new episodes every single Tuesday since 2017. And the more that time passes, and now that we're into 2025, that is a long time. So we're really excited about that. And again, that podcast is really speaking to professionals in the public health industry. We talk about we have those conversations. It's helping to understand epidemiology and talking about the folks that do the work every day, all the time. So Dr. Joy, please introduce yourself and tell us about what you do.
Yes. Happy New Year, everyone. My name is Dr. Joy Washington. I am a community engaged research consultant, and I am the CEO of Joy Washington Consulting LLC. And so what I do is I help organizations to successfully implement their community engagement strategies for both research and practice. And so really what we aim to do is our mission is to really revolutionize public health by transforming public health research into life-changing public health solutions. Because a lot of time, of course, in our work, we see that great things are happening in public health. And a lot of times those things are happening in the walls of academia or the walls of organizations, and it doesn't always get to our community. So we really want to make sure that we get these solutions to our communities, and we accomplish this by working with community-based organizations, nonprofits, public health organizations, health departments, to help them build those meaningful community partnerships, those sustainable community partnerships, conduct impactful research that has a positive impact. Be very clear about that. That has a positive impact. And then be able to use that information and that data to create data-informed solutions that are actionable and that bring joy to our communities. I am also the host of a podcast, the Public Health Joy Podcast, which is a safe space where we have real conversations about creative and innovative approaches to public health research that is done with, for, and by our communities.
Love that. Thank you for that introduction. Erica Horn, please introduce yourself.
Hello. Happy New Year, everyone. It is truly an honor to be here on the show today. I am Erica Horn. I am the CEO and founder of Akiri Consulting, and I get the opportunity to work alongside faith-based organizations, nonprofit organizations, community-based organizations, and help them with program planning, implementation of whatever strategy they're trying to implement or health programming that they have in mind. And honestly, we do everything with solutions with you in mind. So however that looks for you, we will work with you to tailor the specific approach to make sure that we're actually providing services that are meaningful and impactful to the communities that we serve. Super excited to be here and looking forward to today's conversation.
Thank you so much, Eric. I appreciate that introduction. And last but not least, Dr. Thelma Gamboa Maldonado, please introduce yourself and tell us about what you do.
Hi there, everyone. Happy New Year. I can't believe it's already 2025. I am Dr. Thelma Gamboa Maldonado. It's such a pleasure to be here. Thank you, Dr. Huntley, for the invitation. So a little bit about me. I am a public health consultant with over 18 years of experience in health education, promotion, program planning and implementation, and evaluation. And I also have experience in community-based research. So like my colleagues, all of you on this panel, I've also worked in various sectors in state and local government, public health, in academia, and I've also been part of CDC and NIH-funded community-based studies. I transitioned from that world to the world of entrepreneurship starting last year. My journey started around this time last year, and my focus continues to be on being community-centered and community-focused. But more specifically, I am centering on integration of community health workers into health systems, also integrating them into community-based research. So my transition has been from governmental public health and academia, and I'm now focusing more on working with health plans directly. So it's quite a shift. It's been quite a year. It's been a journey. So I'd love to share about it more as we go along in this program.
Thank you. Thank you. That's a wonderful introduction. I'm excited for all of you to be here on this conversation. Our topic today, which is very fitting for January, kicking off the new year, is really about discussing and sharing what your public health priority is for 2025. And when I even framed this question, I knew that it would hit people, it would land very differently. We're in a very transitional political climate here in the US with the change of presidential administration and just all the things that go with kicking off the new year on top of that. It means a lot of different things for everyone. I'm very goal-oriented. All of you know this on the panel for sure. And if you watch us, so if you listen to the podcast and you've been around me any period of time, you know that I'm very focused in that way. For me, I'll kind of start answering this question and then I'll, pass it around for all of you to share your perspectives and, what your priorities are for the year. I know that last year was very challenging for me, both personally and challenging professionally. We had a lot of growth in the business, a lot of shifts and changes, and then a lot of personal stuff in my life that had me just shifting and pivoting and trying to manage. So as I prepared for this year, with all of the things in mind, I really started to think about, what is going to be our priority. And we have a lot of things we want to accomplish. But for us, it really comes down to relationships and community. We talk about these things a lot. As I mentioned in my introduction, our organization really focuses on serving BIPOC communities, so Black, Indigenous, people of color. We have, for the last several years, really supported a lot of tribal organizations, and I'm excited to take a lot of what I've learned in the years of consulting and go even deeper, meaning I want to establish deeper relationships with the people that I already have relationship with, those genuine relationships and conversations that we often talk about. And I think it's because in order to have the deeper conversations that we need to have about health for the communities that we serve, there has to be the relationship there. You have to have the relationship before you can have the really important conversations. So a couple of things that we are doing to prioritize that, just to kind of give an idea with our podcasts. And I mentioned that in the introduction. It has been a very long time in the podcast. And I've been thinking, like, what do we do differently? And if you are a listener of the podcast and you're on our email list, you received an email. And I even talked about it on an episode recently. I'm like, okay, I want to hear from you about what are your thoughts around community? Because way back in the old days, we had a Facebook group when we first started. It had a few thousand people in there, and it just got kind of out of hand, hard to manage. And then we tried to have a LinkedIn group. As much as I love LinkedIn, I'm probably not as excited. It's one of my least favorite features is the groups. So for a while, it's been a little stagnant. But this year, with intention, I really want to have the community. Every time I go to the conferences, I love it when people come up to me and say, "Oh my gosh, Dr. Huntley, I listened to your podcast," and they'll tell me their story about, what they've learned, how it's helped them. But we've set an intention, and we've decided on creating our community on a platform that's not directly connected to social media. And we are investing in a very large way to bring our community together. And just like we always say that, you don't create something for the community without having the community involved. Like right now, we're actively recruiting a small group of our community to get involved with us and help us build what they want. And so we're excited about that. That's one of the things that we're doing as we dive into this year. And I think that is going to be helping us to accomplish what I really want in that part of relationships. And especially with what we have listeners from so many other countries outside the United States, this gives us the opportunity to really establish relationship with our community and have a place that we can create. So that's one of the things. I could go on, but I'm going to pass the mic because we're sharing this. But I'm excited about the sense of community as we grow into this year as a priority for our organization. So I'm going to pass this over to Dr. Joy in the same order that we kind of did our introductions. Throwing the question out to you, what is your public health priority for 2025?
Well, I will say the last time we had the public health roundtable, we talked about our words of the year, and my word was abundance. And so even as we are now in this just getting through this first week of 2025, one of the things that has come to mind for me is being prepared for the abundance, like actually being ready to receive the abundance. And that in public health, that's not a word that we use a lot. But when you think about it, we kind of talk about it in the sense of like a strength-based approach, right? Not focusing on the deficit, not always just focusing on the need, but focusing on the capacity. And abundance is part of that. And so as we kind of move into 2025, one of the things that happened for me last year is as a result of the presidential election, and we were feeling all the feels, right? It was, what do we do now? What do we do next? And the question for me was, well, how do we prepare? The abundance is not going to be lacking, but how do we prepare for the challenges that may be coming ahead because of the presidential election or the results of the presidential election and the transition of the presidential administration? And we are less than 2 weeks away from this actually happening, from the presidential administration changing over. And so what my priority is for public health in 2025 is to help prepare my network, my colleagues, my peers, all of us who are public health consultants and entrepreneurs, is to find a way to support us in how we seek that abundance and prepare for that abundance in our communities, in our businesses, in our work, in our public health day-to-day lives. And so what we are doing, and what my primary priority right now is the Bracing for 2025 virtual summit for public health consultants and entrepreneurs. So what we are doing is we are gathering on January 14th and 15th to really support one another and learn, how do we prepare ourselves to thrive? Like, we want to thrive in 2025. Like, we do not want to be overwhelmed by the challenges that may come. We want to be able to brace ourselves. And the best way to brace ourselves is to stand together. So we're going to be coming together January 14th and 15th for the Bracing for 2025 Summit. And we're going to have, this is what I like to call a multi-million-dollar room. We have speakers and industry experts who have made millions in public health, no matter who was president, okay, from way back when. So we have to come together. We're going to be talking about the potential policy changes. We're going to be talking about DEI, diversity, equity, and inclusion. We'll be talking about your businesses as far as finances, what that needs to look like. How can you pivot and shift and do different things? We'll also be talking about self-care, because that's part of the abundance mindset too. How do you take care of yourself during these times? So we are going to have a great time at this summit. If you want to learn from the folks who have made millions in public health, doing their own thing, doing their own business, being consultants and entrepreneurs, you need to be in this room, because this is the priority. If you are a consultant or entrepreneur, your business is your priority. Your community is your priority. So we've got to learn how to do that together. Oh, and I'm glad we all put our MCHES and CHES in here, because we are offering CHES and MCHES continuing education credits for the summit as well. So that is my priority for 2025.
Thank you. I get excited every time you talk about the summit. So thank you for sharing all of that. And I'm excited for the summit. And I know it's a scary move, but it's a great way of, I mean, you're a leader like that, regardless of whether it takes courage to push past the fear and do it anyway. And that's exactly what you do. And that's how you inspire so many others. So let's move over to Erica Horn. Same question for you. We'd love to know what your public health priority is for 2025.
Yeah, so I really had to sit with this question for a while, because as Dr. Joy talked about her word for the year, I had to really sit and think about what that was for me and how that aligned with everything that I had going on. And so this year for me, it's really just about being in alignment. And so my word for the year is alignment. And I had to see, like, what does that really mean? And it's a position of agreement or alliance, and only saying yes to those things that align with me, myself personally, professionally, socially, just all the areas of my life. And so when it comes to like public health priorities, the things that I'm passionate about, the things that speak to me as far as addressing health disparities and health equity, and just approaching chronic illness and chronic disease and religiosity, things that align with who I am are the things that I am prioritizing for 2025. And so a lot of times it gets hard, or it can be hard when you have a lot of different skill sets, such as a person like myself. It's easy to be put in to assist in lots of different projects here and there, but being able to know that if it doesn't align with the vision, if it doesn't align with the business plan, if it doesn't align with self, then it helps being able to say no. And as a public health entrepreneur, as a public health consultant, as a person who works in a field where all we do is care for others and we are public servants and public leaders, we have to be able to understand that our saying no but our saying no allows us to say yes to the communities that we serve. And so if it doesn't align with me being able to serve my communities, if it doesn't align with personal goal of finishing school, if it doesn't align with professional goals, if it doesn't align, then it's not something that I'm going to be taking on for the year 2025. And so my public health priority is alignment and ensuring that the activities, the persons I work with, the organizations I work with, the programs that we implement, that we strategize, that we create, that I work alongside those organizations, they align with the end goal and the vision for all. So I'm really excited about this year. I'm really excited because there's just so many great things on the horizon, but as you begin to realize what you align with, it makes it easier to fulfill the passion and the purpose you have for life. So that's me for 2025, alignment.
I love that. Thank you for sharing that. And I think I agree with everything you said. I mean, that's very powerful and it's a strengthening position for you, because it will help you, the alignment, the focus, and it all leads to having greater impact, which is ultimately what we want to be able to accomplish, right?
Exactly.
Hey, well, over to you, Dr. Gamboa Maldonado. I would love to hear what your public health priorities are or priority is for 2025.
All right. Well, thanks for that question. Just like Erica, I had to, take some time to think about it myself. And I think for me, being that it's a new year, it's time for reflection. I had to look back at 2024 to see what my priorities were then and what was guiding my vision. And the word that I chose for last year was fearless, because I'm like, I have to just be fearless and jump into this and no looking back. And I was able to accomplish that then, but I recognize now looking back that I wasn't 100% fearless. I don't even know if I was 60 or 50% fearless. There was a lot of fear involved, but I do have to recognize that I did make some changes. I was able to narrow in on my focus area, which is working specifically with community health workers and different programming, and now connecting with health systems. I transitioned out of governmental public health, which was definitely difficult because then there's security that comes with that. But it served its purpose for a time in my life, and I moved on. I started this journey of entrepreneurship with this group, and I'm learning so much from the different stages that everyone's on, and it really is an encouragement. And this idea of self-care and family care, in my reflection, I realize how important that is, because I was fearless and I jumped in and I did so much, but it took a toll. It took a toll on me and my family. And so for next year, 2025, centering on my self-care and my family's care is most definitely going to be a priority, because they are my cheerleader. And if I'm not well, then I can't do the work. So that's one thing. So moving on to next year, I thought, okay, last year my word was fearless. There was definitely a lot of fear involved, but now what's my word moving forward? And for this year, I'm centering on faith. I have a strong spiritual connection, so faith in God, that He's going to walk me through the various things that come my way. Also, fully transitioning from consultancy to entrepreneurship is one of my goals. Making it official, making this a real business. And I'm seeing how others have done it. So walking by faith, I will get there as well. Dr. Huntley, you mentioned about relationships and networking and partnerships. This most definitely is going to be something that I center on this year, because with an 18-year career, you get to know a lot of people, you get to know a lot of systems, you get to know leaders in the field. And so identifying those leaders that I can connect with to move this work forward is going to be very important for me, as well as building the networks and partnerships with community-based organizations and communities. So because in partnership, we can do so much more, and we all can't do everything. So partnerships are really vital to getting the work done. And Erica, your word about alignment, that's most definitely what I'm going to be doing now that I have a better vision of what this all entails. So like you said, saying no to someone or a project or anything that comes your way that's not aligned with that vision is saying yes to yourself and yes to your community. And I learned that through this group, so I'm thankful for that. And I'm really starting to put that into practice. So a lot of exciting things happening for me this year. And I'm really happy that you will all be part of that journey with me.
That is wonderful. Thank you. Thank you for sharing that. I love that you brought faith as a word for you. And it's a reminder. And I think what kind of listening to everyone in this, doing this work, we're often, historically like the background folks in public health, right? When it's challenging, it's even harder to continue in a sense, but we're here because we're called to this work. We care about a community, a cause. We can't individually solve and fix everything, but collectively coming together, supporting each other in our focus, and doing the work that we feel called and led to do is really important. And how we take care of ourselves is everything. I delivered the keynote for the Black Caucus of Health Workers Awards Gala a few months back. And Erica, you were there, of course. That's a part that you're a leader in that organization, in that group. But part of what I shared there was a reminder, speaking to a whole room of leaders, the reminder of the importance of self-care, because we often are, as you said, Erica, not thinking about ourselves first, but we absolutely have to do that in order to continue to do this work, the public health work, serving our communities, advocating, educating, all the things that are important and necessary. So I think it's a bit of what everybody has talked about on this panel, kind of rolled up into whatever the one thing we could name it would be what we would want to share with everyone. So I will just pass back around one more time for give you all the opportunity to share any final thoughts as we begin to wrap up the conversation, which has been really insightful to hear and to be a part of. So Dr. Joy, any final thoughts from you?
I'll say I really appreciated Dr. Thelma and Erica's words as well. I'm a person of faith is also. So definitely hearing how all of our priorities align with each other and with all the different changes and challenges that we may anticipate in 2025, we don't have any reason to be scared. Of course, fear comes along, right? That's a natural human reaction. But the response to that is to get prepared. You ain't got no reason to be scared, but you got every reason to get prepared, right? So even when those feelings come up, your priority is to always figure out, how do I prepare myself? How do I equip myself with the things that I need? And I think that's one of my word last year was exponential growth. And I said the same thing then. I wanted to be prepared for the exponential growth. And there were challenges, of course, but really focusing on how do I prepare myself, that helped me a lot. And leaning on my faith, leaning on saying no to things is all part of the journey. I appreciate the conversation. Once again, if you want to come to the summit, it will be an amazing opportunity to connect with like-minded professionals who are all working to prepare for 2025 together.
Wonderful. Thank you for that. And I will just add, even if you happen to watch this and the summit has already passed, I encourage you to still connect with Dr. Joy, because I'm pretty sure there's going to be a whole lot of takeaways from this event, and it may lead to something else. So there'll be an opportunity for you to be a part of whatever may be coming next. So over to you, Erica. Love to hear any final thoughts you have and you'd like to share.
I enjoyed today. I enjoyed being able to listen to what everyone's plans are. I too resonate with all the words as a woman of faith, as a minister of the gospel of Jesus Christ myself. So I definitely take that in with everything that I do, and just making sure and just thinking about how from last year, my word was intentional. And so it started off last year, just intentional things to make sure I'm positioning myself, but then also while being intentional, making sure they do align. Because you can still be intentional about certain things. And that's, I think, what I was able to glean from last year. I was intentional about saying no here and there, but then what else? It's not just picking and choosing, but making sure they do align. And so definitely understanding that importance of embracing and being prepared for what's to come. So I'm looking forward to the summit. I'll be there as well. So I too am looking forward to it. But I'm really just excited for just this year for what's to come, especially the unknown. And I believe that as we continue to prepare ourselves for the unknown, the best thing we can do is to be prepared for it. So I'm really excited. I have no idea what may happen this year, but I'm looking forward to all the possibilities, the abundance of possibilities that our faith will lead us in, as long as we're doing everything intentionally and aligned in the ways that they need to be aligned. So really excited for this year. I appreciate today's conversation. It was really good and reflective for me today.
Oh, thank you for that. Yes. Loving every bit of it myself. So Dr. Gamboa Maldonado, what are your final thoughts?
I just wanted to once again thank this group for just sharing your experiences and your goals. And it's really inspiring. And that word about preparation, Dr. Joy, that really settles in with me, being prepared to face the unknown. And then when you are not prepared, you rely on your faith. You rely on your faith to get you through. So I just want to reiterate that, and also the importance of connection. Connection builds resilience, and it mitigates any sort of challenges or difficult experiences. So connection and preparation and faith, most definitely. All right, let's do this, right?
That's wonderful. Thank you. And it's perfect reminder too, because all of you who are watching, whether you're live or replay, you see our names here. Please connect with us all. Our DMs are open. So if there's anything that I know often people will watch, but don't like to comment publicly, but they'll like send a message in the DM or a connection request. Perfectly fine. I've been doing this a very long time. That happens a lot, but we are open to connections and conversations, and we're better together. I say that. So thank you all for my wonderful panel for joining and having such a great, rich conversation. Thank you all for attending. And even if you're thinking, maybe you hadn't kind of set your priorities for the year, but now you have some ideas and thoughts, please, I encourage you to do so. Let us know. what you come up with and what you land on. So thank you all for being here. And remember that every month, the first Wednesday of the month, unless it falls on a holiday, we are here live with a new topic and maybe a slightly different mix of leaders at the table. But we look forward to seeing you in the next roundtable as well. So thank you all. Well, I really hope you enjoy that conversation as much as I did. Regardless of where you work, or if you're a full-time student or any combination, everyone can benefit from setting a word of the year to help them stay focused and motivated. I was surprised. That was the surprise that I was alluding to at the beginning of this episode. I was really surprised when each of the panelists began talking about their word for the year. I didn't share mine because I had already used up most of my time during that segment, but I was just letting it unfold as they were discussing. But I would really like to share that with you now. So my word for this year is expansive. I love that word. Every time I say it, I get excited about it. But expansive by definition, wide ranging. At the end of last year, if you're regular listener of the podcast, I talked a lot about how broad our audience is, how many countries people are listening from. I've talked about how we have set an intention to start our own private community again for listeners of the podcast, how we've had that in the past and we're doing that again. And there are several other things that I haven't really been able to update you on that are happening and will be unfolding in this year. This is an extremely expansive year for the business and my vision and all of the things that we will be rolling out with. In fact, at the time of this episode, by the time you're listening to this, there's a group of you who are already involved with rolling out that new community that we're looking to build. So that's even filled with a lot of little secret surprises to come, but it's exciting. It's very expansive. We haven't poured into our podcast community in quite a while because we've just been waiting for the right way to build a community. But now that we figured it out, we're excited to move forward, and we are. So there are a lot of other things to come beyond some of the things I've dabbled about, kind of teased on this episode. But expansive is my word for this year. Excited to see, what I'm going to share with you at the end of this year as we retrospectively look back. So excited to see what's ahead. I would love to know what your word of the year is. Do you already have a word of the year? Or maybe after listening to this, you've decided that you want to create one. I would encourage you to do so. As you heard a lot of our panelists, we've been doing this year after year. And I personally have done it for several years. And it's a great way to stay focused and driven and motivated. So if you haven't done it, I encourage you to do so. Like I said, it doesn't matter if you're a student, any type of professional. You don't have to be a consultant. Anyone can set that as your own personal focus and drive and source of motivation for the year for you. So I would love to know what your word of the year is. You can share it in the comments under the discussion from our Roundtable Live on LinkedIn, or you can also share it in the comments of the show notes page as well. So either way, you can just say, this is my word of the year, type it in there, and we'll be notified that you added the comment, and I will definitely go back and read those. So I look forward to hearing from you what your word of the year is. In the show notes page, we've included a link to the LinkedIn live stream recording in case you would like to add your comments there and join that conversation. Whether you're sharing your word of the year or adding more comments to that conversation, it's not too late to do so, and I really encourage that. In the show notes, well, let me rephrase. The show notes page for this episode, which is episode 390, can be found at phecpodcast.com. Once you're there, just navigate to episode 390 to find the show notes. One more thing before we go. Please take a moment and share this episode with your network or directly with a friend. If you're listening in one of the apps right now, the podcast apps, you can easily share this episode through a text or directly to social media. At the bottom of the show notes page, you'll also find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.